Latrice let me down today, guys. You let me down. I'm not mad.
I'm just interested.
I'm just disappointed. The other thing that vitamin A does is it helps with your immunity group. It's going to help to bolster and develop the immune system. So again, very important in our growth and development diets, as well as our pregnancy diets, which just so happen to be the same diet. The pregnancy and lactation diet, we know that nutritionally they need the same fat, protein, carbohydrate content, so we can just carry that through past whelping into their development. Now, if I can learn what these vitamins do, same thing with the minerals in our next lecture. If I can learn what they do, it makes it kind of easy to figure out what happens if I'm deficient. Because if I don't have them, they're not going to do the thing that they need to do. So when I am deficient, well, I'm going to have retarded growth. For why? There's nothing in this function that says it's going to help with growth.
The bone's not absorbing anything. It says bone resorption.
So bone resorption is breaking down bone.
Oh, okay.
Well, this is a non-energy producing nutrient, but what do we know about all non-energy producing nutrients?
They are required to metabolize.
They are required to metabolize the energy. Bam. If I can't metabolize energy, what can I not do? I'm not going to have the energy to grow. Another big one, well, as I said, if vitamin A is used to create sperm and I don't have it, I have aspermatogenesis, or without the formation of sperm. This one here is kind of a big one because it has to do with the brain. Your brain and spinal cord are kind of held inside this water balloon, right? You have fluid, cerebral fluid, spinal fluid. It just kind of acts as a buffer. It also helps with the passage of nutrients. But if I have increased cerebrospinal fluid pressure, think about what would happen. If I am developing more and more and more fluid in my skull, it can't go this way. The pressure, because my skull prevents the pressure from escaping this way.
Yeah,
So where does the pressure is going on your brain and your spinal cord. And if you start putting pressure on areas of your brain, guess what? Your brain doesn't like that very much. And you're going to start having all kinds of problems. There are tests that we can do on this cerebrospinal fluid and help to relieve the pressure. We can actively stick a big needle in the spinal canal and drain off some of the fluid. It's called a lumbar puncture. Anyone ever had a lumbar puncture? Really?
I think I
No,
saw
but
it
does
in
that
hospital.
happen like with like all the freakies that get the spinal issues and they go paralyzed from the hips down? Is that kind of the same thing?
No,
Or is that IBD?
that's more likely IBDD.
Okay.
This is just where the fluid is accumulating. And if it is nutritional, obviously we first need to resolve the nutritional issue. And then we can drain off the excess fluid. I have had many spinal taps in my day. They suck. They do. They are awful. They literally lay you down on your side, or they sit you backwards in a chair. You kind of hunch over to open up the space. And they take this giant needle, it's called a trocar, and they jam it in between your vertebra. They pop it into your spinal canal, and they drip out just like you tap a maple tree,
Oh yeah.
and the sap drips out. That's exactly what happens.
I've definitely seen it on house.
One of the things they will test for is meningitis.
I had that before.
And other things like multiple sclerosis, They were testing me for the West Nile virus.
I'm
Um,
assuming it's similar to getting it at the door.
It would be similar, the only difference is instead of putting stuff in, they're taking stuff out.
Yeah.
But it's going in the same exact like spot.
Same spot, that
That little,
lumbar,
like, okay.
that lower back, and they pop the needle in. And then you have to-
It hurts more than that.
So how bad is that?
Yeah, I've never had that before.
It is very uncomfortable.
Okay, so 1 to 10.
So, well, so I've had them both where they gave me a local anesthetic.
Okay.
So all you really feel there is the pressure, and then you physically feel it pop
Oh.
into the spine. It's almost like it burst through a crust.
I
That's nice.
And
No, I didn't feel that. They gave me like a loopy med to put
yeah,
in. They gave
well,
me-
I've had so many of them. I've had it where they froze it. I've had the loopy meds.
Yeah.
I had one where they didn't freeze it, and it is, I have a pretty high pain tolerance. And out of a 10, it was probably about a 6 or a 7. And then what sometimes happens, which is even worse, I know I've gotten off, but that's okay. It's my class, I can do what I want. Sometimes what will happen is, so when they pull the needle out, you now have a hole. Normally, your body will patch it up just like if you cut yourself, it gives you scab. Sometimes it doesn't, and you just continuously leak spinal fluid. Well, the problem is then your cerebral spinal fluid does the opposite. The pressure is too little, and your brain literally kind of shrinks, and you develop what's called this. Anyone who suffers from migraines, yeah, you know the kind of migraine, the worst one you've ever had, where you physically cannot open your eyes.
Oh, you can't see.
You can't move. There's a halo around everything, and you are literally just laying there, usually vomiting on yourself.
Yeah.
Yeah, so I had that for a week.
Ooh.
I had a 5-day spinal tap migraine where all I could do was lay, and I had to lay on the tile floor because the hard tile on the back of my head kind of felt good. And that's all I could do for 5 days is lay on the tile. It was awful. It was, never, I wouldn't wish that on my worst enemy. So if I have a deficiency in vitamin A, that is one of the things that can happen is this increased cerebrospinal fluid pressure. How do we know when an animal has a headache? Because that's one of the first symptoms is you're going to develop a headache because you've got this compressing. They make pod so when we have a headache, what do? We push on it.
I squeeze my
So
head.
to put
Or
their
you
head on
squeeze on it.
a wall or somewhere hard.
Say it hard. Say it again.
They put their head on a wall or somewhere hard.
Yeah. So they'll just
Oh, that's
walk.
right, they just go walk up to
They'll
it.
just walk up to a wall because they obviously can't be like, ooh, that hurts, or ooh, that hurts. They'll go up to a wall and they'll just lean on it. And that's called head pressing, and that's a very significant neurological finding. Nice job. All right, so remember these are fat-soluble vitamins, which means that we are much more likely to see toxic effects than deficiencies. Not to say we can't see deficiencies, but because we can store them to a limited degree, we can start seeing them spill out into the blood. And so when we start seeing a toxic effect of this vitamin A, I'm going to explain what this is. Oops, I didn't do that very well. Cervical spondylosis. What cervical spondylosis is. So first off, where am I talking about? Your neck, not your cervix, that's somewhere else. Cervical vertebra is in your neck. And if we were to look at the vertebra, here's a cervical vertebra. Here's another cervical vertebra. You get the idea. So there I have 3 cervical vertebrae, and I should have nice, clean spaces in between them. What spondylosis is where I start developing these little bony bridges, these little bone spurs that eventually will hook together. That's a problem because then I no longer have mobility.
Right.
And sometimes these little bone spurs will break off and float up. So my spinal cord is right here in between. And these little bone chip will break off and float up into the space and put compression on that spinal cord. That's what spondylosis is.
They get like, don't their necks get like real stiff and they can't move?
Yeah, their neck will get stiff and there's nothing we can do.
Yeah.
It's not like we can go in and do surgery. We just need to support them as best we can.
Could you give them like medication for that or not? Like anything to
Keep them
help?
comfortable. That's
Right.
about it.
You can't go in or move it at all.
'Cause it's in the spinal column, right?
Yeah, it's a bony spur that's coming right off. It's now part of the vertebra. We also see it in old dogs, but more in their lower backs. This is one of the few times you'll see it in the neck.
And it's mainly cats. correct?
And it is mainly in cats.
What does it do with spinal vertebrae?
It forms these little bony bridges, these little bony spurs that will prevent movement. And sometimes the little bony chip will chip off. It's called a joint mouse. And it'll float up and cause compression on the spinal cord.
Is that kind of common though? Like you see
It is not super common, and we do primarily see it with a vitamin A toxicity. That's one of the few things that will, in fact, you will see it. So if you see the cervical spondylosis in a feline, check the diet first and foremost. Erythema, that's a great word. Does anyone want to guess what that might mean?
red or something.
It is red something.
Is it the lack of
It's not lack of red,
Oh, too many red blood
which would cause what?
Skin reddening?
Yeah, very nice. I don't know who said that, but well done. It's going to be reddening of the skin. Let me give you a human condition that is similar. There's a human condition called rosacea. So a lot of you have heard of it.
Yeah.
Like my sister has rosacea, unfortunately for her. And if she has any alcohol at all, her cheeks and her nose and her face go bright, bright red. She's not blushing. She's not embarrassed. It's just a reaction to the alcohol, which is a pain when we're trying to sneak stuff at my parents' house on Christmas morning. Christmas morning, we're like 10 o'clock in the morning. We're like, oh God, I really need something to get me through this day. And then my mom will come in and be like, what are you girls doing? And Tina's like telling on us with her face.
Oh my
I
gosh.
think my brother has rosacea, and I've told him that forever. He's just bright red all the time.
Yeah. And it's just, it's not even a physiological thing. It's just a condition. And then with the vitamin A toxicity, another thing that we might see is long bone fractures. Vitamin A does have a function with bone resorption, and bone resorption is where you break down bone, right? I'm shedding epithelial cells all the time. I do need to break down bone to remodel it, right? Break down old bone to reform new bone. But if I have too much of the thing that breaks down the bones, I overbreak down the bones. And I end up with these super brittle bones. And I'll get what is called a spontaneous fracture, which is non-traumatic. And what I mean by that is I'm just like, ah, and my leg breaks. We had this, so this was not a toxic effect. We did have many years ago, oh Lord, it was the Chinese crested hell that we were in because of, oh God, this has to have been 7-8 years ago now. The Houston Humane Society, the SPCA, had done a huge puppy mill seizure of all Chinese cresteds.
Oh,
So guess what we got
they're so cute.
when we had our shipment of animals come in?
A bunch of them.
We had a whole butt ton of Chinese
They're
cresteds.
so cute.
Oh,
I hate those.
I love it.
they're fabulous, except these were puppy mill dogs.
Aw.
They had when I say that they didn't know how to walk, I don't mean they didn't know how to walk on a leash. I mean they physically did not know how to
Their
walk.
feet are all like,
They were in a cage their whole life, and you would put them on the ground, and they were like those fainting goats. They would just like slowly fall over, and they just. So we would take them into classrooms. We would just socialize them as much as we possibly could. Problem is that nutritionally they were a train wreck. So they developed, not because of the toxic effect, obviously, because they were deficient, but they developed these spontaneous fractures. So we had a student, these chairs are not high off the ground. So they were just sitting in the intro room, and they had one of the little dogs on her lap, and the dog just jumped down from her lap. Not even from this high chair, from a low chair. Broke its leg. We had 4 of those dogs break their legs. 4 of them. 3 of them we ended up having to amputate the leg.
Oh my God.
3 of them?
3 of the 4 we
What did
amputated.
they break?
Well, the problem was because of their nutrition and their health issues, we set the bone, put a cast on it. It didn't heal.
Okay.
And like 4 weeks later, it looked as fresh a break as what happened. So because it was a non-healing fracture, there's nothing you can do. So just take the leg off. They did fine after that. I mean, they did okay. But yeah, 3 of the 4 of them, we had to amputate the legs.
Did
It
they
was,
get a doctor?
do what?
Did they get a doctor?
Yeah. Yeah, they all went.
You can just let them like the little baby thing. Just put it
Oh
there.
gosh, they were a mess.
Wait, how many were there? Since it was
We had a total of I think 6 of them here. We had only 2 of them were hairless. The others were the powder puff.
I love those. I love those. They're so cute.
Oh, I don't mind this little hairless one, the powder puff one's creeping me out.
Oh no, they were pretty cute, except because a lot of their hair had fallen
Yeah,
out, so they just had like a little tuft here and a little tuft here.
Oh.
They were very pitiful. They were like, a 13-year-old boy trying to grow a mustache and a beard. A little bit here and a little bit here.
Oh.
All
They're so cute.
right, so the next one is vitamin D. And the great big thing that it does is right here. Everything that has to do with bone mineralization, bone resorption. So we have 2 minerals that are the primary constituents or components of bone, calcium and phosphorus. And in our companion animals, calcium and phosphorus must be maintained in a 1-to-1 ratio. So if we don't have a 1-to-1 ratio, let's say I've got a bunch of calcium and I don't have phosphorus in circulation, my body's going to start pulling it out of the bone because I need to have that 1-to-1. This guy needs a buddy. Everyone needs a buddy. It's a heart. Everyone needs a BFF. So if I have too much phosphorus, I start sucking calcium out of the bone. If I have too much calcium, I start sucking phosphorus. If I start sucking out a primary ingredient of bone, guess what happens to your bones? They get very brittle and they start breaking down. So I like to think of vitamin D, I don't know what you guys use, but like online dating. Vitamin D is the Match.com for calcium and phosphorus. That's the one I know. I don't even know if that's still a thing. Match.com. It's whatever. It's a date.
Tinder.
No, it's not Tinder.
Why you say it like that?
I don't say it like anything. I got nothing. My stepson met his wife on Tinder. Yeah. I got no problem with internet dating. Heck no. The one I know is Match.com. So vitamin D is Match.com, eHarmony, whatever, kettle of fish, plenty of fish, whatever it is. Biker Kiss.
Bad one.
There's another one called Biker Kiss. Anyway, my point is that it's vitamin D job to maintain that 1-to-1 ratio. However, it has to do so. Pulling stuff out, putting stuff in, maintaining that ratio in circulation. So everything with vitamin D is going to have to do with skeleton and bones. We're gonna see if I have a deficiency, things like rickets, osteoporosis. Somebody tell me osteoporosis.
Isn't it loss of calcium from your bones?
It's opposite. It's the loss of bone. That's where like older women, you guys don't have to worry about any of this yet, but older women, you have to have your bone density checked because sometimes as you get older, your bones will demineralize. Osteoporosis, osteomalacia. What is malacia? So osteo is bone, softening. And so you have one where you get the brittle bones because we've lost the bone density. And we have one where you get the soft bones and they start bending like noodles. Rickets is where we have during growth and development an abnormality in the development of the long bones. And it'll cause the legs. Now this is different than being bowed-legged, right? You got your bulldogs, you got your pugs and your Boston Terriers that have those little bowed out legs. This is different. This is where the long bones are not supposed to genetically be like this, but they bow dramatically. And in fact, would say, take out your phones and Google image search canine rickets. Go ahead. This is one of the few times I'm gonna actually say, take your phones out. Take me up on it. Canine rickets.
Also happen like this way too, like you know their wrists.
And they're, yeah,
They,
the
like,
whole,
walk on their
Oh
whole
my god.
there you go. That's the reaction I was looking for.
Why would you make me?
Is it always that extreme?
No, it's not gonna be overnight where like yesterday he was fine and today he's all jacked up. It is gonna be progressive.
There's some that look cuter, but still.
I've seen boxers that were in a puppy mill and their whole front was like they walked on the whole entire.
Yeah,
Like,
it's called it's called neuropathy.
Yeah.
so on here, they have like the riblets or like and then they have one where.
So it's a true malformation of the long bones. That's rickets. Because again, vitamin D has everything to do with appropriate bone growth and development. So if I don't have it, if I'm deficient, I don't grow and develop normal bones. Makes sense? Yeah, it's not good because now their joints are out of alignment. They're gonna develop the arthritis, osteoarthritis. They're gonna have muscle issues, movement issues. Yeah, all of the effects.
So does that happen a lot in like the large breeds if they're growing too fast and they're not getting enough at the same like?
Yeah, definitely nutrition the faster the animal's growing, the more important nutrition is
Right.
during that growth and development phase. If I am too much vitamin D, I'm going to have hypercalcemia. Somebody tell me what is happening there.
Calcium.
Excessive calcium where? In the blood. Which is, where do you think I got all that excessive calcium floating around in the blood? I sucked it out of the bones. What is funny? Eric, you are just having a day today.
The crest dog thing.
The what?
The crest dog story.
Oh, okay.
It's sad, but kind of funny.
It is sad and kind of funny.
It's like the
Like,
just like you know,
dogs are so-
really laughing.
Yeah.
That's
It was
okay.
Like it was like
Yeah, and it's just like.
Yeah. That's okay. You can laugh at that. I have no problem with that. So if I'm sucking calcium out, I'm going to end up with lameness. So everything to do with bones. All right, so on to vitamin E. Vitamin E, probably the one you're most familiar with right now. It is a biological antioxidant. What do antioxidants stabilize? Free radicals. So what happens here is the antioxidant, because we all have taken antioxidants. You've heard like blueberries, red wine, high in antioxidants. And so I find you at the grocery and I've been stalking you and I stop you and I'm like, I see that your cart is filled with foods that are very high in antioxidants. Might I ask why? And you're like, why are you following me this up? Well, anytime you have any sort of cellular damage, which is when? All of the times you're having cellular damage. This is going to create these free radicals. And what free radicals do is they run around and destabilize. We have these atoms, these with electrons. Remember, oh my God, does that ever feel like a gazillion years ago? Remember, we want the same number of electrons as protons. We want to keep it balanced. We also want the outer shell to be full and satisfied. So when we have a satisfied atom, what free radicals do is they'll run over and they'll steal an electron. That's what they do. They just run over and they just take one. Well, now I've got an atom who's no longer happy. And now what that atom does is it runs to another atom and steals. And that runs to another one and steals. I used to do a play. I've written a play. I'm waiting for my Tony Award. So I used to do a play and I'd have some of you guys volunteer. I'm not going to have you do it. I'll just explain it to you. It was called Free Radicals Invade the Prom. And so what I would do, what I would do to demonstrate the role of a free radical and how because there are two different ways that the antioxidant can stabilize. So the first one, I have two couples up here. All right, and they've joined, oh, I can't do that, joined arms. And these are my two couples. This is my prom dates. I've got two prom dates. And we're dancing and we're having a great time and there's not a care in the world. And then my free radical comes over and is eyeing them up, and free radical is just a miserable old soul. He just wants everyone else to be miserable because misery loves company. So what happens is he comes up, or she, doesn't matter, and breaks up one of these happy couples and steals one away. Well, the one that's left is just like, I can't believe they left me on my prom night. And I got all dressed up and I got all the photos and I don't even know. And so basically they go out to the parking lot and they key everyone's car. Because they are just pissed off.
Oh my gosh.
And so we have a damaged creating more damage. Here's what antioxidant does. There are two scenarios. Scenario one is antioxidant comes over and says, you know what? They don't deserve you and their shoes are ugly. So you and me are going to be best friends and I am now going to be your prom date. Okay. And we bond together and we stop the damage from going further. Or antioxidant sees free radical over here eyeing up these two happy couples and says, hey, free radical, you really don't have to break up a happy couple. I know you're just misunderstood and I know you just want to be loved and you just want a friend. And I will be that friend for you. And they bind with the free radical and prevent the damage from ever starting. Antioxidants are pretty great. They're pretty great. They want to be a friend. They're there. They're taking the bullet for you. Taking one for the team. So vitamin E, we have a lot of different things that act as an antioxidant. Remember, ascorbic acid, antioxidant. Vitamin E, type of antioxidant. And so although they function pretty much the same way, we do have several different buddies that we can use to bind with these free radicals. If I'm deficient in vitamin E, I'm going to develop sterility, specifically in the males. I'm going to explain this word here in a second. Now, there's one thing that I would like to point out. I'm sorry. Here. Do you start to see a little bit of a pattern with one of these deficiency symptoms? Anorexia. We talked about this. Anorexia is going to be the most common across the board deficiency symptom there is, regardless of the nutrient. We talked about it with our protein deficiency. We're talking about it now with our vitamin deficiency. We'll talk about it again with our mineral deficiencies. Deficiency equals anorexia. So we have sterility in our males, steatitis. Well, we know it's an inflammation of something. This is a condition, the common term for it is yellow fat disease. Pansteatitis would be all of the fat. Where do you have yellow fat?
In your
Bone marrow.
Well, for adults, it's in the.
It's in the bone marrow.
You have it in the bone marrow. Where else? Yellow fat is everywhere. That's pretty much your adipose tissue. So now imagine all of your adipose tissue is inflamed. So every inch of your body hurts. That's pansteatitis. And so that is not good. Definitely not good. No bueno. And then, of course, immunodeficiency. The more your immune system is having to fight off the guys out in the parking lot keying the cars, the less time they have to defend you from foreign invaders. So if we have an immune system whose attention is divided too much, we can't focus on anything specific. Does that make sense to everybody? Are you okay? What is happening? I'm so concerned for you right now.
I have chronic migraine.
Oh, okay. You do what you need to do. Whatever you need to do. If you need to lay down, put the back of your head on the floor, although I would probably put it something underneath your head because these floors are disgusting. Sweetheart, whatever you need. If you need to go get a glass of water, go, go, go. I'm just sitting here. I'm aching for you. Do I need to dim the lights? Do you want me to turn out the lights?
Just a little, but I'll be back.
I will do that for you. Go, go, go. Go, go, go. I'm just up here like, I'm just having a stroke.
She was fine downstairs.
I know, she came up here just like, here I am, do.
Yeah.
And I'm like, is my lecture really that boring today? That you're just like, oh God, I can't even KMN. All right. Vitamin E is really not all that toxic. The very worst thing you're going to get is increased clotting time. So what is happening if you have increased clotting time?
You're gonna clot really fast.
You're going to clot slower. The time to create a clot, so it's just the opposite, but think of it this way. Increased clotting time is we are increasing the amount of time it takes to form a clot.
I didn't even read the reverse part.
And it will be reversed with vitamin K.
You're gonna need vitamin K.
So if we have a toxicity of vitamin E, we can reverse the results with vitamin K. So yeah, increased clotting time, you cut yourself, and where it would normally take however long it takes you to clot, multiply that now by 2-3 times. So you're bleeding for a lot longer.
You got me saying vitamins.
Why? Yeah, I can't read vitamins.
Yeah. I just said it right now and I was just like, wait, what?
Why is E and K the most common deficiency?
Why is what?
Was E and K the most common deficiency?
So vitamin E is the most common deficiency nutritionally, more for when people are cooking for their own pets. Vitamin K deficiency, which we're going to talk about here in a second, not necessarily a nutritional deficiency. What happens with vitamin K is something has gone wrong, and even if you're taking it in, your body is unable to use it. So you have the deficiency in the ability to use it. We're going to talk about that in 2 seconds. So do I have any comments, questions, concerns so far? Is everybody okay? Does everyone now see the benefit of this chart where instead of this one thing, we would be like 15 more slides at this point?
Yes, yes.
I love this chart. Vitamin K equals blood, specifically blood clots. Vitamin K, blood clots. When you cut yourself, there is a lot of stuff that has to happen in order for you to form a clot. It's really pretty remarkable considering we don't really think about it at all. I don't think about it. You're going to learn about the clotting cascade when you get into clinical pathology with Ms. Regalia next semester. For right now, I'm not getting into all of that. What I'm going to explain is when you cut yourself, there is what I call the clot ladder. This is a ladder, and each one of these steps is a different clotting factor. You have clotting factor hemophilia A, hemophilia B, von Willebrand's. You guys have heard that one. Dobermans, Rottweilers. In order for you, so at the bottom, I really need to stop going up and down here. So this is where you cut yourself. This is where you form a clot. But in order to form the clot, your foot has to touch every single solitary rung on the ladder. So you can see if, let's just say I'm missing let's just say that's the von Willebrand's factor. And the von Willebrand's factor is missing. What has happened to my ladder?
Don't remember it.
I don't have one of the steps. Can I get to this? Oops, now I'm just erasing everything. Can I get to this step?
No.
No.
Because what do I have to do? Touch every single rung on the ladder. So guess what happens?
You don't clot.
You don't clot.
Bleed.
Humans most commonly are missing the hemophilia factor. And in fact, the disease is called hemophilia. And what hemophiliacs, you cut yourself, you don't clot. You just keep bleeding and bleeding and bleeding and bleeding. Dobermans, very prone to having von Willebrand's, they're missing that clotting factor. They just keep bleeding and bleeding and bleeding. Okay, so how does vitamin K work into all of this? Vitamin K is the ladder. Every clotting factor is a rung. Vitamin K is the physical ladder.
So when you do the surgery on like a Doberman, what difference you have to do?
Oh, geez. So every hospital's going to be a little bit different. At our animal hospital, we did additional pre-surgical blood work on all Dobermans. We did a platelet count. We also did a fibrinogen analysis, which is the little Spider-Man webs that the platelets pew, pew, pew. Because what happens is with the missing von Willebrand's, number one, they produce less platelets, so you'll have an overall reduced number. And the platelets never activate their Spider-Man power. And if they don't activate their Spider-Man power, you don't get the fibrinogen web that is there to form a clot. So we would do additional pre-surgical, and if they were found to have von Willebrand's or a decreased platelet, we'd send them to the specialist. We weren't even gonna mess or jack with that at all. Even a routine neuter, nope, they could bleed out, send them to the specialist. So
Do they like, do you know what they do differently?
they will usually have a lot more prophylaxis. They'll have multiple catheters. They'll have whole blood, fresh frozen plasma on site waiting to be hung. They'll do a lot more of the micro surgeries that we're just not capable of doing in general practice. So vitamin K is the latter. So if I don't have it, I don't clot. There. So if I am deficient, ooh, I do have a highlighter. Look at that. Prolonged clotting time, hemorrhage. That's one of my favorite words. Oh, I don't like that because you can't really see it now, can you?
Hypothrombemia? Did I say that right? Hypothrombemia.
So we'll do this.
Hypoprothrombemia?
This is hypoprothrombonemia. I love this word. Let's break this word down, shall we? Hypo, low, pro, before, thrombo, platelet, emia.
Lack of.
Where it was emia
Blood condition.
in the blood.
blood, right?
So this is a lack of the pre-thrombocytes in the blood. So the cells that become thrombocytes, I have a lack of them. Hypoprothrombonemia. So a lack of the pre-thrombocyte, the pre-platelet cell in the blood. But it also makes you sound so smart. It really does. This is my go-to word. So whenever my significant, I don't even know what he, honestly, if you had a gun to my head, I could not tell you what he does for a living. He's a systems engineer for a wireless broadband. I don't know what that means. He puts internet where there is no internet, usually for the military and the oil fields, where there is no internet tower for them to connect to. So they'll go out and put up temporary towers, but you have to do like a specific map.
Sounds expensive.
You have to triangulate the towers, and it's very complicated. I don't know. But when we get with his other system engineer techie friends, they're like, yeah, the Whipple 284-7G was pinging at a rate of 2.754, and the other guy's like, whoa, how'd you get that? And I'm just sitting there like, and so I'll just look at him and go, hypoprothrombonemia. And that's my signal for, I have no idea what you're talking about.
The lack of.
It's a lack of the precursor cells to thrombocytes in the blood. So it's a lack of baby platelets. We don't got no baby platelets, which means we got no adult platelets. So vitamin K, everything blood clot. If I have too much, it's really not toxic. You can't really overdose. It's not like it's going to overclot your blood. So just like vitamin E, minimally toxic. Where we see the vitamin K deficiency is not a true nutritional deficiency. When we are looking at things like rat poison, rat bait, warfarin, so there is a therapeutic drug, it's a blood thinner called warfarin. These stop your body ability to use vitamin K. So even though you may have it, you can't use it. The latter is it locked in the garage, can't get it. And that's how rat poison kills the rats. The rat goes in and eats the rat bait. The rat bait blocks the rat's ability to use the vitamin K. Well, vitamin K is not just important when you hurt yourself. I have a lot of holes in me. Holes. I got a bunch of holes. I got even the pores of my skin are holes. And so what ends up happening, I've got holes, remember little fenestrations in all of my blood vessels to allow blood cells to move in and out. Vitamin K is the thing that keeps me from bleeding out of all of those holes. So with the rat bait, your blood vessels just go, and you start hemorrhaging into your chest cavity. You start bleeding into your abdominal cavity, and you essentially drown in your own body fluids.
My God, that's kind of like crazy.
You're also bleeding out of your eyes, your nose, your mouth, your ears, your penis, your vulva, your anus. Sometimes you're even leaking blood out of the skin. But they also are very high in sodium. What happens to you when you have a lot of sodium? You get thirsty. So the rat in my house, is there any water supply for the rat? No, they leave the house in search of water and then they die out of the house. Where that's a danger is now I've got a cat. And the cat sees this sick, poor rat. Cat does what?
Eat it.
Eats it. What has the cat now ingested? Rat poison. Yeah.
Over the cousin of my friend's lab, I ate the rat poison, and they told her to like pour hydrogen peroxide.
Yeah, so what you need to do immediately, because what happens is, so the rat poison goes to the stomach, small intestine, gets uploaded into the blood, because we know that's what happens with everything you eat. Blood goes where? Everywhere. So what I need to do immediately is induce vomiting to try and get it out before it gets to the small intestine.
So you guys do hydrogen peroxide to induce vomiting?
You can use hydrogen peroxide. You got to be kind of careful with peroxide. We would use peroxide, but there's also a drug called apomorphine.
Yeah.
You grind up and put it in your eyes. Yes, yes, I did. Yes, I did. Thanks for remembering. So, but what we need to do is get them to throw it up, and then we have to supplement them. We basically just throw as much vitamin K at them as we possibly can, hoping that some will be able to be used by the body.
So my boyfriend's friend's tattoo artist had like a bit puppy, and it had gotten into rat poisoning, and he asked me what to do. I was like, well, I don't know, take it to the vet. And it was too far along, and then the puppy ended up dying. And so I'm just like, how do you like prevent that from ever happening?
So immediately, like you have to start the vomiting the minute that you see them eating it. 10, 15 minutes later, it's going to be too late.
Yeah.
Now we can give them things like activated charcoal, which will help prevent it from being absorbed into the blood. We can then supplement them with massive amounts of vitamin K, but even then it's going to be a touch and go. There's a reason why it's rat poison for a reason.
Right.
All right, so we're going to stop and we'll pick it up here on tomorrow. We are going to be lecturing tomorrow. And we will be finishing up this slide and continuing on and finishing up our fat and water soluble vitamins. So you guys have a wonderful, wonderful day.